palliative care means end of life, means possibly hospice, but ultimately when you start talking palliative care, you feel like you're accepting death. And that's a part of the process that can take people a long time to get to. And it's certainly not a necessary part of the process at the beginning of a dementia diagnosis. So palliative care, I was surprised to learn, is not the same as end of life care. So palliative care is a process of managing symptoms and managing pain when treatment of the illness is no longer a possibility. We're not going to cure whatever you have, but we can make your life with it more comfortable. So one of the experts that I spoke to at a hospital in Vancouver, she directs the palliative care unit out there, and she said, you know, me and my team are constantly selling ourselves and our services to the people who just don't want to talk to us. And she says to me, you know, people are afraid that if we are dispatched to their room, that means there's something that the doctor's not telling us because the palliative care unit is here. And that's not what it means. It means, first of all, we want to make a directed plan for how you or your loved one is going to live out the rest of your life. And when you introduce palliative care, apparently, studies suggest that your life is in fact extended by almost 3 months in some cases with cancer, and in other studies as much as a year. So let's say your mom has dementia and she is starting to become hospitalized more frequently, because that does happen as the disease progresses. There's lots of things that can start to go wrong. But the hospital experience is very difficult for people with dementia. It is not easy for most of us, but when you have dementia, delirium can set in, the environment is brand new. It's a little bit in your face, in the sense that people have to touch you, they have to draw blood, you have to sit in the bed, you have to follow directions. It can be very difficult for people with dementia, so they can become delirious and unsettled. And you can imagine if that is something that ends up having to happen every month because you have started having aspirational pneumonia, which is one of the markers of the final stages of dementia, that the swallowing mechanism becomes compromised and you regularly are having food or water or saliva go down the wrong way, which can cause infection, and you often end up in hospital. So do you want to keep going to the hospital and treating the infection and then having it come back and going to hospital? These are the questions that palliative care asks, and that the team of doctors and nurses on the palliative care unit will force you as a family to talk about. And so she was saying, this doctor out west was saying, you know, in an ideal world, this is a conversation you've had with your mother years before she ever gets to the hospital. Under what circumstances do you want to continue to have medical treatment? What kind of medical treatment do you not want to consider having? Is intubation okay? Will you take any kind of drugs? Do you want to be fed through a tube? Like, what are your sort of markers and lines in the sand? For most people, what ends up happening is you have those conversations when it's an emergency, when you're already at the hospital, when things are dire, when it's a little bit fraught, because you may not know. I don't know what my mother wanted, and it's a lot of responsibility. I don't want to make that call on my own, and yet she can't. So palliative care teams can come and help you ask the questions that you need to ask of yourself or of your loved one if they're able to contribute in some way, but even if they're not. And so they can also explain to you what the choices are. So this doctor was saying out west, a lot of times people don't realize that you don't have to take all treatment that's being offered to you. You will always be offered pain management, and your comfort is paramount. But if you have some kind of infection, you don't have to take the antibiotics that cure the infection. We're going to or whatever drug it is that's going to deal with the infection, but we will deal with the symptoms of the infection. And as she said, and then we can talk about letting life take its natural course, but that doesn't mean that it's going to happen tomorrow. That doesn't mean that this palliative care conversation is actually accepting that your death is today or next week. It means deciding how the end of your life will eventually go. But in early steps, having conversations and knowing what your options are. And it's one of the more difficult parts of the process. But if people start asking for palliative care earlier, they may find that they have extended time with their loved ones and that their loved ones have more time in comfort.